Welcome to another episode of Weight Loss with Dr. A.
Hello and welcome to another episode of Weight Loss with Dr. A. And on this episode, I wanted to invite Erika, our nutritionist, because we have a really good and interesting subject that we wanted to discuss with you. And patients with a sleeve and patients with without a sleeve. And we wanted to talk a little bit about carb cycling. And carb cycling differs from other ways of going with dieting and low carb and other forms of working with the sleeve or your weight loss surgery procedure. So for that, that's the main reason I invited Erika. She's our expert here to talk to you and explain a little bit about carb cycling. So Erika, how are you doing?
I'm good. How are you doing, Dr.
Doing great. Thanks so much. So thanks so much for being here with us and helping our patients understand a little bit more about carb cycling and giving us the tips and tricks that we can give out to patients for them to be able to get the most out of their weight loss surgery procedure. So let's start by saying, or maybe just by defining what carb cycling really is.
Okay, so pretty much carb cycling, it's a very interesting approach because it does combine kind of like the keto lifestyle and as well eating a more carby diet. So it's pretty much rotating the amount of carbohydrates that you're eating during the week. So usually the approach is having 3 low carb days, and then you can have maybe 2 moderate carb days, and then you allow yourself to have 2 high carb days as well throughout the week.
So the difference, and I'm a big advocate. I really push my patients toward a low carb lifestyle. I truly believe they patients do really good with the sleeve, because the sleeve will limit the amount of calorie intake. So that takes care of that part of the diet. And if they work a little bit with the chemistry, lowering their carb intake, it boosts greatly their weight loss. Yes, and I've been doing low carb. I've done it several times. I've done it for sometimes I stick to it for over 3 years. And you recently suggested for me to try carb cycling, and the main reason was exercise.
Yes, exactly.
Yes.
So we have to keep in mind that carbohydrates have their place in muscle recovery and overall give us energy. I think that's something that we already know. So the good thing about carb cycling is that you have a good amount of days during the week to go low carb, and so your body pretty much needs to find a fuel to give you enough energy for exercise, so you will start using your fat storage. But then as well, during the days that you have a little bit of more of a high carb intake, you will be able to restore your glycogens, your muscle will get stronger, it will build better, and as well you will be able to have more energy for your workouts.
And I know you may not be so into professional training or maybe bodybuilding or anything like that, but the truth is a lot of athletes are looking into this because it is proven to reduce your body fat, but at the same time protect or even help muscle growth.
Yes.
And doesn't happen with a keto lifestyle or a very low carb lifestyle, right?
And as well, another benefit that you can have besides keeping the muscle and reducing your fat is as well that it could help with insulin sensitivity when you are doing lower carb days.
Yes. So would you or who would you suggest can try this lifestyle? Would be everybody? Would be weight loss surgery patients? Would be who?
Yes. So I do think that everyone could give it a try, because I do think it's somewhat of a healthier approach, or at least to tiptoe into the whole keto lifestyle in case that you don't like it or you do like it, you could give it a try that way. But I do think it is something a little bit more suitable for people that work out a lot, that they're more active. But as well, I guess it depends on the approach that you want to take. And I mean that usually in the low carb days, you tend to go a little bit more up with the fat. And in the higher carb days, you go a little bit lower with the fat intake. But when I was researching a little bit more about the topic, I did see that a few coaches that were going either to lower the fat or to lower the protein. So I do think that if you are someone that it's more into bodybuilding, or you're looking into increasing your muscle, it will be better if you will be dealing with carbs and protein. And if you're looking more for fat loss, it will be better if you're dealing with the carbs and the fat.
Okay, correct. So where should someone start? I mean, of course you can do your own research online, go jump into YouTube, Google good articles on it, but where should you suggest someone start beginning to research or build their carb cycle? How about that? I'll help you out with that. I'll help you out with that.
Okay.
So with the carb cycling, it is very important people understand there's going to be a very, very extreme low days of low calorie, low carbs. And you need to count the carbs, all right? So the cycling goes like, I'll give you an example. It could be like Sunday, Monday, Tuesday, extremely low carb, all right? And then you may have a medium, moderate day of carb intake, and then you can jump again to low carb, like Thursday, Friday, and then Saturday. Let's say Thursday, Friday, and Saturday low carb again, and then Sunday it would be a high carb day.
Yes. So the main thing with carb cycling is to not put two high carb days next to each other.
Correct.
So you either want to reserve the high carb days for days that you know that you're going to be doing way more exercise than your regular, and as well days that maybe you will want to have a little bit of a treat. So let's just try not to do Saturday, Sunday, both high carb days, because your fuel, your tank of fuel is already full, and if you just continue to add carbs,
stored as fat,
it's going to be stored as fat.
Yes. So that's why it should be just one day of carbs, the rest of the day being low carb. And I've seen it with myself, with my training. Sometimes when I had a sustained like keto lifestyle, sustained keto, low carb, whenever I did like weight training, I was fine. I was perfectly fine. And I'm at the gym and I can take my pace and I'd be fine. But when I did like extreme cycling, that differs, because with the cycling, the fuel, the glycogen, the sugar is very important there. And I would hit the wall. I would feel terribly weak, bad. I had to stop in my tracks, and it was the lack of carbs.
Yes.
And so with the carb cycling, it comes down to a good, it's very suitable for patients or training people who exercise quite a bit. And if you're looking into this, you've got to a point that, okay, now I've got my sleeve, I've lost 80, 70, 100 pounds, 100 plus pounds, whatever. You want now to focus on the amount of fat in your body. This would be a really good way to go if you're doing a good amount of exercise.
Yes, and I do think that it's a very useful tool, because I have been receiving quite a good amount of emails lately where patients hit the stall, and the first thing that they want to do is reducing even more the calories. So there's a little picture that I would like to insert right here just to make it a little bit easier to understand. So just to use hypothetical numbers, We have to remember that the body by itself, just doing regular activities, breathing and moving,
just
and
living,
just living, not doing much else, we do have a maintenance amount of calories. So regular diets or calorie deficit works because we go below that maintenance. So let's say that we are in 1,000 calories for maintenance. So we go for a 700 calorie diet. So since we're doing a 300 calorie deficit, that's when we start getting some weight loss. Obviously the body evolves, the body gets adapted, and it's gonna reduce now the maintenance. It's not gonna be 1,000 anymore. Maybe in 3, 4, 5 months, now your maintenance is gonna be 700. So what are you gonna do? Are you gonna lower up to 400? And so that's the point. The answer is not to eat less. The answer is to find a way to make it a sustainable weight loss.
That is very, very important, because you want something that you don't see as a diet, that you're dieting. You need to find something that you see as a lifestyle. Because when you say dieting, you're focusing, just the word itself, it's you're focusing on eating certain things and certain things you can't, or eating certain amounts and having a deficit, a sustained deficit. But as you mentioned, you need to look for something that is sustainable, something that you can continue doing for longer periods of time, and something that you can adapt as well to that lifestyle, that way of eating. Very important. I've seen carb cycling, I've researched, I've done it myself, and I see it even with my trainers at the gym. They normally do like Monday, Tuesday, Wednesday low carb. They do Thursday being moderate, and then they do Friday or Saturday low carb, and then on Sundays they see it like their cheat day, where they pack in quite a bit of carbs. Of course they're fit, and they're also trying to lower their body percentage, and it works. I mean, they do really good as well. So what would be the definition, like the difference with a cheat day or a cheat meal versus carb cycling?
Yes, so it is very important to remember that even though carb cycling is not extremely restrictive diet like other ones that we have seen before, it's not as a restrictive approach, we have to keep in mind that carb cycling is to get to a certain goal. We are looking to really lower the body fat. Maybe we're really trying to lower the body fat and building a certain amount of muscle. So it does need to be a little bit more control. So even I do see a lot of people that get confused with a high carb and a cheat day, because in a cheat meal you just eat whatever you want. If you want to eat nachos, if you want to eat ice cream, if you want to eat this and that. But we have to keep in mind, even though the carbs are high, the fat still has to be on the lower side, so you don't mess up too much with the chemistry. So yes, you could eat certain things, but we have to keep in mind that if you want to eat ice cream, it's a little bit higher in the carbs, but it could be a little bit higher on the fat too. So it's not the same that, oh, it's a hard carb day, let me just go into a rampage and just eat whatever I want. You still have to be methodical in trying to hit certain macros.
And that's why bodybuilders on those higher carb days, they look more into rice, grains, pasta, because the fat, of course, is not that high, and the carb is more pure.
Yes, very simple carbs.
Correct.
And not really like a complex kind of meal.
And as you mentioned a few minutes ago, that carb go directly to the muscle, store to the muscle, help recover the muscle, or for muscle activity and performance. And then the low carb days will help lower the fat in their body.
Yes, so you pretty much have the best of both worlds. You train your body to use the fat storage, and as well you train your body to take those carbs into the muscle.
Yeah. Should one try to figure out this themselves? Should they, I would strongly suggest they seek out a professional advice here,
Yes.
because it's not that simple as going just just going to do low carb or keto and that's it.
There are a lot of resources online, and you could totally try to take that approach. But if it's the first times that you are trying to go into a certain diet, if you don't know how to calculate macros, if you don't know how to estimate your daily calorie maintenance, I mean, it's gonna be a little bit challenging. So it is the best if you could look for professional help or just send me an email.
Yes, I would strongly advise you to seek out the advice of a nutritionist, a certified nutritionist, because it's not that simple. It's not that simple as just going low carb. You need to see what days you work out, what days work for you, what days you can use as moderate intake of carbs, what should be your high carb intake, the amount, the low carb estimate, so on and so forth.
And just to do all the math for you, just to do all the meal plan for you, we could keep it very simple as well. It could be a little bit more complex, but it still requires some time, and it still requires some experimentation, because every body is different, and there are some people that tolerate carbs way better than others, and maybe in the lower carbs days, there's people that could deal with 40 grams of carbs. Some other may have to go even lower to 10 or 20 grams of carbs because they don't tolerate it as well. So there's still gonna be some of an experimentation trial kind of period. It's not gonna be super effective right away, but once you get the hang of it, it's gonna be way easier to figure out.
And of course, it's always easier for someone to keep an eye on you,
Yes.
keep you accountable, and that way you'll get the better or the best results possible. And that, along with your sleeve, I mean, results are astonishing. They're really, really good. Anything else you'd like to add?
No, really is just highlighting the benefits. Remember that carb cycling really allows for the fat loss, maintaining your muscle. As well, it is very important, or it's very beneficial to regulate hormones, and more than anything, leptin and ghrelin, which are the ones that regulate the weight loss and the hunger in the body. Those ones are going to be the ones that will give you more fat burning effect if we get to the point that we regulate them. And as well, it could help you with your insulin sensitivity.
Yeah, yeah. Well, I really like the topic. I think it's not a very common topic, but it's indeed something patients can grab, get a lot of useful information, maybe get them going with even further weight loss or even further minor detailing that they want in their body, like lowering their fat or having better results, performance while exercising or longer periods of exercising, etc. So, Erika, well, thanks so much. I really enjoyed the topic, really good information, and I know the audience got a lot of good tips. Thanks so much.